Imagine this. You're in ancient Egypt, 1600 BC. A healer is applying a honey mixed with resin to soothe your burn. Fast forward to 400 BC, when Hippocrates, the father of medicine, is using pig fat and vinegar to treat burns. A practice that might seem strange today. Throughout history, burn treatment has evolved from tea leaves in ancient China to wine and myrrh in ancient Rome. But not all ancient remedies were beneficial. Some even included the use of feces, highlighting how much our understanding of burn care has progressed. Yet despite all this progress, some myths about burn treatment persist even today. Let's dive into a couple ones. But before we get started, if you're new here, my name is Cassandra, a wound care and family medicine physician. Whether you're a healthcare provider or a caregiver or someone who just loves to learn, you're in the right place. And a big thank you to all my current and new subscribers. Your support means the world to me. And if you just found this channel, don't forget to hit the subscribe button and the notification bell so you're always up to date on the latest wound tips. Myth number 1, applying ice to a burn. One of the most widely believed myths is that applying ice to a burn helps soothe the pain and reduce the damage secondary to a burn. While it may seem logical to cool a burn this way, using ice can actually cause frostbite and cause further tissue damage, making things worse. Myth number 2, using butter or oils as a remedy. Another outdated remedy is using butter or oils on burns. This not only is ineffective, it can make the burn worse by trapping in heat, which causes further burn damage and increasing the risk for infection. So how should you actually treat a burn? Before we actually dive into the correct treatment, let's talk about the different types of burns. The first and least severe are first-degree burns. These only affect the outer layer of the skin, so they cause some redness and pain, much like a sunburn. Then you have second-degree burns. These go deeper, affecting the outer layer and the inner layer of the skin, causing swelling, blisters, and severe pain. Finally, we have third-degree burns. These are the most severe kind of burns, affecting all 3 layers of skin and even underlying tissues sometimes. They may appear white or charred or leathery. The treatments that we're going to discuss today are mainly for first-degree burns, the most common type of burn. So what should you do when you get a minor burn? Well, here are 5 medically approved steps. First, immerse the burn with cool tap water or cover with a cool cloth. You're going to do this for about 10 minutes or until the pain subsides. And again, don't apply ice to the area. It can only make things worse. Next, apply petroleum jelly to the area 2 to 3 times daily. Avoid ointments or butter since they can cause infection. Another common remedy for burns is aloe vera, and for good reason. Aloe vera has natural anti-inflammatory properties and can soothe the skin, making it a great option for minor burns. Apply a thin layer of pure aloe vera gel to the area 2 to 3 times a day for best results. When it comes to topical antibiotics, it's best to avoid them. Things like Neosporin and other topical antibiotics, they're not necessary, and on top of that, they can potentially cause allergic reactions. Stick to petroleum jelly and or aloe vera gel and let your body's natural healing process do the work. Then what I generally like to do is cover the burn with a sterile non-stick bandage. I would allow blisters to heal on their own. Do not pop the blisters. And for pain relief, I found a lot of success with over-the-counter pain medications like ibuprofen or Tylenol to help with the pain and reducing the inflammation. And once the burn has healed, I generally like to use sunscreen or apply protective clothing over the area to reduce scarring and reduce redness. While ancient healers tried their best, we now know a lot of the science behind burn care. Remember, using ice on burns isn't just outdated, it can be harmful. So just stick with the steps that we talked about to ensure a safe and speedy recovery. Thanks for watching. If you found this video helpful, hit the subscribe button to stay up to date on the most up-to-date wound care tips. And don't forget to check out my other videos for more wound care tips. Stay informed and heal well.